Why do we do chest compressions? Why CPR? A lot of us don't know why. It's not just pressing the chest. Hello everybody, hope you're doing well. Welcome back to my channel. This is the Health Gospel. I am Dr. Idee Charles. This is where we discuss our health and those common things that we need to know about ourselves and our health. Today I'm going to do a continuation of the video I did last week on CPR, why I need CPR, and today I'm going to be telling us when exactly do we do CPR, because in the last few weeks we've seen, or maybe a lot of people think, when somebody collapses you just have to do CPR, or when somebody slumps you just have to do CPR. And if you've not watched my last video, go and watch it when I talked about the different causes of collapse, or why somebody will slump or faint. I talked about the different causes, so go and watch that video so you can get up to date with where we are. Today I'm going to talk about when do we do CPR. You only do CPR on one condition only, and that is when somebody has a cardiac arrest. What is CPR? Cardiopulmonary resuscitation, and it's only done on somebody who has a cardiac arrest. Now, how will I, a layman, say, so how do I, what is cardiac arrest? How do I know somebody's in cardiac arrest? I mean, somebody's collapsed in front of me, somebody's fainted in front of me, somebody's slumped in front of me. Should I not just go pressing the chest? Now, cardiac arrest is when somebody's collapsed. You as a layman, anybody can do this. I mean, anybody. So you just get yourself aware of what to do. When somebody's collapsed on the ground, what you need to check for, is this person responsive? Is this person responsive at all? Is there any sign of life? And how do you do that? You shake the person, you call the person, hello, 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 are you hearing me? Can you hear me? The person is not responding, not even moving anything, not moving any arm. And then you want to check if this person is breathing. So how do you check it? You have to just put your head over this person's nostrils, or just watch and see, is there any breathing? If there's no breathing and you feel the pulse, most of you know where to feel the pulse. I'll put up the symbol up here. You feel the pulse, there's no pulse. That is when you start chest compressions. You start chest compressions immediately. Some people breathing can become agonal, so it's they are gasping for breath. So once in a while they gasp. That's also cardiac arrest. They're not breathing. That's abnormal breathing. So you need to still start chest compressions. Chest compressions is done at the rate of 100 per minute. 100 per minute. That's the rate. Giving us 30 compressions at a time. So you give 30 compressions for every cycle, and then you give 2 rescue breaths where you do mouth to mouth, or you can use a valve or something to separate your mouth from the person's mouth, and you give them 2 rescue breaths, and you go back to giving chest compressions. You have to press down the chest up to the depth of 2 inches. That's the deep one. Why do we do chest compressions? Why CPR? A lot of us don't know why. It's not just pressing the chest. You do CPR because you're trying to squeeze, push down the heart to pump blood to circulate, and you're trying to get, when blood circulates, you're trying to get oxygen to the brain. You're trying to get oxygen to the brain. So if you have that at the back of your mind, if you're pressing down at that depth that is recommended, 2 inches, about 5 centimeters, you're pressing that chest down, up, down, you give it a recoil, let the blood fill back in the heart, you press it down again, give a recoil, let the heart feel it fill back with blood, and press, you're trying to squeeze blood out of those heart to circulate to the system. That is why we do chest compressions, and you give 2 rescue breaths, which is some form of oxygen, which will help the brain to perfuse so this person can come back to life.
When a person collapses, there's still enough oxygen in their blood to keep them alive for about 10 minutes, but only if that blood gets to the brain. Chest compressions build up the pressure that keeps blood flowing to the heart and brain. If you stop pumping the chest for any reason, the patient's blood flow stops too. Continuous chest compression, CPR, keeps the oxygen-rich blood flowing.
CPR is just buying time. We are buying time to get a defibrillator to actually check what is going on with the heart. Does this person need a shock or does he not need a shock? So when people say CPR will save our life, in some cases, just with 1 or 2, 3 compressions, some people, very, very rare, come back. Probably they were not in cardiac arrest. But chest compressions buy time for actual intervention, resuscitation, post-cardiac care, and all that. Is quite a bit of medical intervention. But if you're in a scene, before anybody comes to you, you can actually start chest compressions, because this will save this person's life. This will buy time. This might just buy time. This person can recover if those chest compressions are started on time. And the only reason, I repeat, we do chest compression is when somebody is in cardiac arrest. Cardiac arrest is when the heart stops beating and you are not breathing. So this person is not breathing and the heart has stopped beating. That is the only time you do CPR. Apart from that, there's no indication for CPR. When do we not do CPR? Person has, I do not want this resuscitation, so please do not touch me. Don't press my chest. At that point, please, you let the person go. What other ways can we help people at home who are choking? You can give them rescue breath. People who have severe asthma, they cannot breathe. You can actually give them rescue breath until help comes. These are just things you do until help comes. So if help is not coming, then you're just going, how long will you carry on chest compressions? You're going to be tired, because help has to come. There has to be an intervention. So this is something that we have to be aware of. CPR is not a treatment. It's not a definitive treatment for somebody who has a cardiac arrest. It's just an intervention to buy time. It will help you to push that blood into circulation and get oxygen to the brain. But we need a definitive looking at the heart, the rhythm, whether we need to shock it, whether we need to give adrenaline. That is the only way we can restart that heart. But even with all this process where we can do, there is still very low chances of this person coming back. So my stand is always, let's go on the education part, let's go on the awareness part, let's create awareness. Why would somebody have cardiac arrest? I'm going to be giving us reasons why we can have cardiac arrest. And one of the primary reasons is if somebody has a massive heart attack. Why would somebody have a massive heart attack? Do not miss my next video, because I will be delving into the causes of cardiac arrest. Why would somebody have cardiac arrest? In so many ways, we are all going to learn from this, because there are things that we can actually prevent before it can happen. But there are cases where we cannot prevent, but things that we can prevent before it happens. So do not miss my next video when we talk about indication. Why would somebody go into cardiac arrest needing CPR? Subscribe to my channel, like this video, and please share it so that we can actually learn from one another. We are learning on the Health Gospel. It's an education awareness channel. So please subscribe and like our video. I'll see you next time. Take care and be good. Bye.